We have a statistic from 2008 from Indian Health Services, which shows that we have about 19.5% of our people have been diagnosed with diabetes. The problem is tremendous. Anybody you talk to, if you came to our nation, either has diabetes, knows someone that has diabetes, and probably knows someone that's had some very serious complications with diabetes. We have a lot of issues with obesity, where people are overweight, and as you know, that complicates and is usually a prerequisite, or it causes the onset of diabetes a lot faster. We also have, as I mentioned, the poor diet. We eat more processed food. We don't go out and hunt or go out and pick the plants that we normally have used in years past. Another area that is causes a lot of problems is stress.
I want to explain a little bit about how stress really does influence the physiology and lead to diabetes and to the complications of diabetes and eventually to mortality if we don't do something about it. So these risk factors lead to morbidity, increased morbidity, meaning more signs of heart disease, heart attacks, stroke, etc., and greater healthcare utilization, greater healthcare cost, and eventually, of course, if they're not dealt with in some significant and useful way, then they lead to early death. I don't know how many people realize that cardiovascular disease is, in most cases, a complication of diabetes. Diabetes is not something that just starts when our blood glucose happens to reach a level of 126 milligrams per deciliter. It's something that really starts much earlier. If the the normal level of glucose is taken to be 80, then by the time we've reached 90, we're already experiencing the bad effects of diabetes, even though we're very, very far away from the actual cutoff that has been used clinically to define diabetes. This is a study that compared the transcendental meditation technique, the effects of the transcendental meditation technique on something called trait anxiety. You can see the relative effectiveness of all of these techniques is much less than that for the transcendental meditation, and that in the case of concentration, we get no effect. And we'd get some effect with the others, but it's really very low.
This research has been conducted by researchers from the Maharishi University of Management. So the first slide is a slide which shows changes in blood pressure. And this is important because blood pressure is one of the risk factors that needs to be tightly controlled to prevent complications of diabetes. And this slide shows that. You see the green line, the TM technique significantly reduced blood pressure in comparison to an eyes closed situation or progressive muscle relaxation, another type of relaxation. There was a larger drop in blood pressure. It was twice as effective as the comparison groups. And so TM had a powerful effect on blood pressure. Insulin resistance is a physiological dysfunction that leads to type 2 diabetes. And here we see that TM can reverse that and change that. This slide is a slide that shows the decreased hospital admission rates in all categories of disease. This was the first TM study on healthcare utilization patterns. And this was a large study of 5,000 practitioners of the TM program in which they were compared medical insurance utilization rates to a Blue Cross Blue Shield database norm. And the findings show that the TM practitioners had significantly lower medical care utilization rates, indicating that the TM technique fosters and promotes health and well-being and longevity in the population.
There were times when my sugar would elevate up over 500, which is high. And occasionally I'd have a reaction where my sugar was too low. And since I started TM, my sugar's been where it should be, So I'm sold on TM.